Are there any questions? Member for Narrabeen.
Thank you, Speaker. My question is to the Minister for Health. On Sunday, 91-year-old Lois Casboult had a fall at home. Her daughter found her on the floor bleeding and in pain and called an ambulance. Lois's daughter asked the paramedics to take her to hospital, but they said they couldn't because they were the only paramedics available in the area. Shame. The paramedics then helped Lois into her daughter's car. Her daughter had no choice but to rush her mother to hospital. On arrival, Lois was assessed and found to have a bleed on the brain and a broken pelvis. Minister, why is our health system so broken that there are not enough ambulances to transport severely injured Victorians, such as Lois, to hospital?
Minister for Health.
Thank you very much, Speaker, and I thank the member for his question. At the outset, can I say this has clearly been a very distressing incident for Mrs Casboult and her family. I know that she will be receiving first-class care at Warrigal Hospital, and I wish her all the best with her recovery. As is my practice, I will not be providing commentary on individual cases in this place. However, I am advised that Mrs Casboult was attended by our highly skilled paramedics, who in this case also sought information and advice from the virtual emergency department, including from emergency doctors and emergency nurses, and that they together determined a plan for Mrs Casboult's care. Again, I wish Mrs Casboult a speedy recovery.
Member for Rowville. Supplementary question, member for Narrabeen.
Thank you, Speaker. Why won't the Minister take responsibility for the appalling failings in our system and guarantee that there is an immediate investigation undertaken?
Minister for Health.
Thank you very much, Speaker. I'm also aware that both the Victorian Virtual Emergency Department and Ambulance Victoria have provided a response in relation to Mrs Casboult's care. I want to point out that Ambulance Victoria have confirmed that there were no ambulance resourcing challenges at the time of Mrs Casboult's injury.
Member for Narrabeen has a point of order.
On a point of order, Speaker, on relevance, I'm asking the Minister to have an investigation. I'm sure if this was the Minister's mother, she would investigate them.
Order. Member for Narrabeen, I'd ask you to raise points of order in the correct format. Deputy Premier, on the point of order.
Just on relevance, Speaker, the Minister was being relevant. Standing Order 58.2. The Minister will have discretion to determine the content of any answer.
Order. On the further to the point of order. Order. Member for Brighton. Member for Brighton on the further point of order.
To the point of order, Speaker. What we've seen already, but all week, is ministers refusing to answer questions.
What is your point of order?
Further to the point of order, Speaker.
And what is the point of order?
The question directly went to why the government won't allow an investigation, why they've ruled out an investigation, and the mate, what do you do every time you're on 3 hours?
Order. Member for Brighton will order. Order. Member for Brighton will leave the chamber for an hour. Member for Pakenham is warned. On the point of order from the member for Narrabeen and the further point of order from the Deputy Premier, the Premier was being relevant to the question that was the Minister was being relevant to the question that was. So has concluded her answer.